Stark State College Massage Therapy Lab Notes with Michael Vahila, licensed acupuncturist and licensed massage therapist.
So treatment of the deltoid, first of all, we have a list there of the symptoms associated with dysfunction, and that would be pain in the lateral shoulder, so just exactly where the deltoid is, but it can refer down to the elbow. So somebody might say, I have pain here, and it extends down my arm. So there may not be anything going on down at the elbow, it can just be referred. So that's just something to be aware of. Generally, it's easiest for most of the deltoid, with the exception of some of the posterior fibers, to treat them supine, but you can even get the posterior fibers in the supine position if you just put your thumb behind. If you really need more specific focus there, then by all means have them turn over. And always it's a good idea to warm up the muscle first. So how do we warm up a muscle? Any kind of kneading warms up muscles. So petrissage of the muscle. Now, is that sore at all there at that level of pressure? Okay. Now, as I work on you, if the pressure is too strong, you just let me know. So one of the things that happens is many times people who do neuromuscular therapy, they may skip the step of warming up the muscle, and I don't recommend that. I really recommend that you warm it up at least a little bit. In fact, usually if you're going to work on a deltoid or an arm, do your whole basic arm routine as the warm-up and then go into the detail work. So after you've warmed it up, you just lightly lubricate the deltoid, and you're going to do deep friction strokes with your thumbs. Now this can work a couple different ways. It can be, like in this position for me, this is the best angle for this. So remember, the deltoid starts here, comes down to about here, and you feel that deltoid tuberosity. So have in your mind the image of the muscle, and then glide with moderately firm pressure along each segment. So as I glide along there, is there anything in particular there that's sensitive? Maybe right there. Yeah. So as you glide, you are looking for trigger points. So this is not just an exercise in doing the deep friction stroke, but you are also simultaneously doing reconnaissance where you're paying attention to what does that tissue feel like. That felt a little gristly to me there. She also said that it was tender. So the trigger point treatment technique is you don't need a lot of pressure to find the trigger point. Once you've located it, then this is where communication with your client's really important. So you tell them, so this is a tender trigger point here. I'm going to treat that by sinking into it with pressure. I want you to tell me when to stop when that pressure reaches mild to moderate discomfort. Another way to say that is no more than a good hurt. Or, and some people prefer the scale of numbers, if 0 is no pain and 10 is severe pain, stop me somewhere between a 4 and a 6. So if that's an easier way for them to gauge that, that's how you do it. So tell me when to stop with my pressure.
Right there.
And then you're simply going to hold that for 10 to 15 seconds. I'm usually still talking to them a little bit, especially if this is new for them, so they get used to the process. And right about here I'll say, and as I hold this, does that feel like it's changing or easing up at all?
It is easing a little bit.
Okay. It doesn't have to change a lot or ease a lot, but there has to be some change. If they say, no, it's staying exactly the same, or it's more intense, that means it was too much pressure. Now, they were the one who calibrated the pressure, but this is kind of an educational process for them too. This is where you get them to understand that more pressure is not better, we're looking for the muscle to relax or ease off. If it doesn't, it just means it couldn't respond to that much pressure. So even though they were comfortable with it, so then I'll tell them, well, stop me sooner the next time. So next trigger point I find, say instead of stopping me at, say, a 6, stop me at a 4. And then we'll see if we get a better response. So once I've done that trigger point, then we'll glide through that a couple more times. Now it seems like there's something up here as well. Is that a little sensitive
Yeah.
also? Okay. So I found another trigger point, and again, I'll sink in slowly. If that didn't ease up as much as you thought it should, maybe stop me a little sooner with the pressure.
Okay.
And say when.
Right there.
So trigger point treatment is really quite easy. It's just a little bit time consuming or tedious because you're going literally point by point by point. It's very, very helpful for people who have any kind of neuromuscular pain. As I hold that, does that feel like it's changing a little bit?
It's easy.
Okay, great. So that's what it's supposed to do at ease. So I was gliding through this most interior segment of the deltoid, found and treated 2 trigger points in it. So then, again, this is a deltoid-shaped muscle, so I'm going to move laterally and do another segment. So 2 or 3 strokes, and again, already I can feel a couple suspicious points along this line. I would say maybe right there. Okay. So I'm just going to do one more trigger point just to demonstrate this, but once you do that, that's simply the process. So it's not a complex process, it's just one you repeat over and over and over again. So again, tell me when to stop at mild to moderate.
Right there.
Okay, so that was very mild. So that's the good news. If you try to gauge it, see, I would not have normally stopped at that pressure. That doesn't feel like anything to me. But if the tissue is really injured, it doesn't take much pressure. And so as I hold that, does it feel like it's starting to change a little bit?
It's right there. Just ease.
Okay, just ease, okay. All right. So a good rule of thumb, no pun intended, is treat 1 or 2 trigger points and then do some friction, and even just some general friction. This can get a little bit intense when you can spend an hour on a shoulder. So imagine just going trigger point after trigger point after trigger point. That gets a little brutal for people. So do a trigger point or 2, do some general friction. This feels nice. It lets them assimilate that change in their tissue, and then you can go back at it and go through. Because really on her, I might do 10 trigger points in the deltoid alone. So say hypothetically this is a shoulder injury that we're dealing with, and we're going to be treating all of the rotator cuff muscles. Well, we have to get through the deltoid first. We might end up treating the pec major, the rhomboids, but it's very easy to spend an hour on a shoulder. And when you're doing this, because you're going in for a lot of detail. So that process, just to kind of speed it up then, now I'll be going on the most lateral head. So there's actually quite a bit in here that needs treated. So I feel several points in there that are suspicious to me. As it comes around to the posterior head, I'm just going to change hands and glide up that. And again, I feel a couple points that could be treated as trigger points. I don't think I need to demonstrate that any further. And then bringing the thumb around for the posterior head of the deltoid. So that's really all there is to that part of the treatment. Now in your notes, it also says to cross fiber the lower borders of the clavicle, acromion, and spine of the scapula. So that's the origin, right? And when you cross fiber tissue, that's just another way of treating that, helping the muscle relax. You don't necessarily treat trigger points here as you do that. You don't have to do a lot of pressure here. Just 4 or 5 strokes all around the origin. Also, as you're treating these muscles, this will help you remember the origins. Think, okay, the origin is the lateral third of the clavicle, the acromion, the spine of the scapula. And then also lightly treating some short strokes over the deltoid tuberosity. And don't overdo it there. This can be very tender. But that's the insertion. So giving a little extra attention to the origin and insertion. On a practical level, many times I don't do the two things that I just said. I don't cross fiber this, I don't treat that. If you get the main trigger points in the belly of the muscle, that's probably 90% of the work. If you have a lot more time and you want to do that other stuff, fine, but this will get the bulk of it. And that's the treatment of the deltoid.